All right, we'll go ahead and get started. Good morning, good afternoon, and good evening to a record number of you joining us from around the world online. And it is so much fun to see old friends and new friends showing up in the chat. Hello to all of you. Personal hello. I see all of these introductions coming in there. And yes, please do continue to introduce yourselves in the chat. We're looking forward to a rich discussion today. And I just wanted to offer a couple of housekeeping items before we kick off. One is please do continue to use this chat to introduce your name, organization, and location. And then if you have questions, please use that Q&A function through Zoom at any time, and we'll be addressing questions after the panel discussion. We are quite a large group today and still growing. So attendees will be muted throughout the webinar, but we encourage you to share reflections and comments in the chat. So I'm Jennifer Shuba, President and CEO of the Population Reference Bureau. And on behalf of PRB and my colleagues, I'm delighted to welcome you to the launch of our new webinar series, Hot Topics in Declining Fertility. At PRB, we believe demographic trends are never just numbers. They reflect actual experiences, aspirations, and policy choices. And few trends are as consequential or contested today as the global decline in fertility rates. That's why this series will tackle some of the most urgent questions arising from this demographic shift. How does lower fertility intersect with reproductive rights, with the future of work, with urban planning, economic development, national security, and more? These aren't just academic questions. These issues touch nearly every aspect of society, every corner of the globe, even places that still have higher fertility, as we'll see. This has been a focus of my own work for much of my career and of PRB's for decades. I'm thrilled that we're taking a deeper, more inclusive, and comprehensive look now. Reproduction has long been politicized. There's nothing new about that aspect of this moment, but it's being politicized in new ways as fear of the changes lower fertility brings to society, reaching a fever pitch in some circles, from decision makers even to social media influencers, which of course my algorithms pick up on and feed me daily. To be fair, some fears are rooted in real challenges. In many countries, social security systems are predicated on continued population growth. Work is evolving quickly, and aging populations are raising profound questions about care, innovation, and productivity. Countries around the globe are grappling with how to maintain economic resilience as birth rates decline. But we also see well-funded actors using demographic anxiety to justify rolling back reproductive rights, rather than strengthening support for individuals' health and autonomy. Some are using falling fertility as a rationale to restrict access to contraception and other critical services. That should concern us all. In just a few weeks, on July 16th, PRB will launch our State of Access Contraceptive Policy Scorecard at a virtual public event. I believe we'll drop a link to that in the chat. The scorecard is an interactive web feature that untangles the complex policy environment for contraceptive access in each of the 50 states in the District of Columbia. It's a great complement to this event. It looks fantastic. I've seen a preview and really will fit in well with all that we'll learn today. As we start this series, it's important to situate today's fertility trends in a broader context, which my colleague Toshiko Kaneda will do in a moment. For now, I just want to note that past alarm about high fertility rates brought some abhorrent coercive policies we'd never wish to see repeated. At the same time, concerns about the health and economic implications of high fertility encouraged investment in public health and in education, investments that have left a positive legacy. In fact, historically declining fertility from very high levels has often accompanied gains in women's health, economic development, and educational attainment. So we have this puzzle here. Will this moment of demographic anxiety lead to more thoughtful and supportive policies, or to backlash and restriction? That's one of the core tensions we'll continue to explore throughout this series, not just today. But as we'll discuss today, what we need now is a more holistic vision of reproductive health, one that centers people's desires, and goals across the life course, not just their childbearing years. This means addressing fertility rates with individuals, not just at them, and recognizing that reproductive decisions are deeply personal, yet deeply influenced by these larger social and structural factors. So far, most conversations about low fertility have centered on high income countries where this happened first, this transition, but fertility is falling nearly everywhere. In the late 1960s, more than 120 countries had fertility rates above 5 children per woman. Today, there are only 8 out of about 200. That's a dramatic transformation. So in this first session, we're intentionally flipping the script, shifting the focus toward low and middle income countries while still drawing lessons from countries that have been navigating lower fertility for decades. So one of the central questions for us is, how do we move from panic to purpose, from demographic determinism to a more human-centered approach that supports people's personal, professional, and reproductive goals? This shift requires self-reflection too. I've spent over 20 years exploring these issues from both scholarly and policy perspectives. And over time, I've become increasingly aware of how the framing of demographic data shapes its reception and its consequences. It's not enough simply to raise awareness of demographic trends. We also, I think, have a responsibility to anticipate how different stakeholders will interpret and apply that information. So the language that we use to describe demographic change doesn't just inform, it influences. I've learned that how we frame data shapes not just understanding, but action. And that realization has made me more intentional about choosing language that recognizes complexity rather than reinforcing fear, and more committed to placing people, not panic, at the center of this conversation. And I don't think I'm done evolving in that. And PRB has evolved as well. Some of our earlier work framed fertility decline as a goal in and of itself, kind of along with the times. That's not how we approach the issue today, and we're still learning. That evolution is not a liability, it's a strength. It reflects our commitment to staying grounded in evidence and responsive to actual experiences. There's still much we don't know. But one thing is clear. While fertility trends affect nations, it's individuals who experience them. Outside of context of coercion, governments are not the main drivers of fertility decisions. People are. Fertility doesn't fall because of propaganda or ideology. It falls because people weigh their options and decide what's best for them when they have the choice. The most effective policies recognize that reality. Likewise, governments can't, and especially shouldn't, force more births, but they can create policy environments that foster greater well-being, policies that support individuals and families to flourish. So with that, I will turn things over to my colleague, Toshiko Kaneda, Technical Director, PRB, who will help us understand how we got here and where things may be headed next. Thank you again for joining us.
Thank you, Jen, and welcome everyone. I am Toshiko Kaneda, the Technical Director of Demographic Research here at PRB. For the next 10 minutes or so, I'll give a brief demographic snapshot of global fertility trends to help us frame our discussion. Next. So let's start with this map of the world. The countries in dark blue have total fertility rate below replacement level, so 2.1 children per woman. Nearly 2/3 of the world's population now live in countries that have below replacement fertility, and that's over half the countries in the world fall into this category. As you can see, that includes not only countries in Europe, North America, and East Asia, but also many in Latin America and the rest of Asia. So the shifts have been widespread. Now let's take a closer look at how we got here by comparing fertility rates 50 years ago in 1975 to today. Next. So in this chart, each blue dot represents the total fertility rate for a single country in 1975. So there are around 230 dots, little dots here for countries and territories around the world, and they're grouped by region, and yellow dots show the regional rates. You will notice substantial variation in the rates, within and across regions in 1975. For example, in Asia, TFR ranged from 1.6 in Macau to 8.4 in Yemen, with a regional rate of 4.4. In Africa, TFR was 6.7, while Europe had already seen fertility fall to replacement level by 1975. Next. Now I've added orange dots to show 2024 rates next to the 1975 rates. So as you can see, the declines are dramatic, particularly in Asia and the Americas, where you see not only lower fertility, but substantial narrowing of the gaps between countries. So in both regions, average fertility has dropped by half or more since 1975, now sitting at less than 2 children per woman. Despite the large declines, Africa still has 4.1 children per woman on average, but with wide variation across countries from 1.2 for Mauritius to 6.0 for Chad. And even within regions like Asia with low regional rates, large differences do remain within. And we also see much variation within many countries, as many of you know, say like by urban and rural areas and by education, though we're not showing them here. So while global fertility is converging downward, the aggregates do hide much variability. Next. Now, let's look not just at how many children people are having, but at what age they are having them. So here are age-specific fertility rates since 1975 for 3 regions, Africa, Asia, and Europe, broken down by 4 age groups. So we have age-specific fertility rates age-specific fertility rates. Let me define that first, the number of births per 1,000 women in the specific age group. So we've got the years along the x-axis, and age-specific fertility rates are along the y-axis, and different color lines for each age group. So you can see that teen fertility, which is shown in light blue, has declined across all regions. Now take a look at the 20 to 29 age group, which is the traditional childbearing ages shown here in green line. It's also coming down fast. And however, in Asia and Europe, fertility in the 30s in orange lines has stabilized or even increased. If you look at Europe, we in fact see a crossover where fertility rates in the 30s now surpass those in the 20s. So this suggests that people are postponing childbearing, which has led to dramatic declines in the number of children people are having. And we are seeing growing impacts on the demand for fertility care across different countries as a result. Let's look at Africa. So in Africa, fertility decline has been more uniform across all age groups. So this suggests that we're not seeing delays in childbearing, not to the extent that we see in these other regions, though we do need cohort data to have full understanding of this picture. So what explains the delay in childbearing? Many factors, including better education for girls, more women in the workforce, access to modern contraception, alongside various social and economic pressures like high cost of raising a child and lack of family-friendly policies. Next. So why is there so much concern over low fertility? This slide shows the global population pyramid in 2024 on the left side and what it's projected to look like by 2050 on the right. So looking at the pyramids on the left, today we still have a broad base of young people with much smaller cohorts at older ages. But by 2050, the pyramids on the right is projected to become more rectangular, right? So more older people on the top relative to younger age groups below. So as fertility falls, population ages, and it's aging fast. we go from having a lot of workers and less need for old-age support in the pyramid on the left to fewer workers relative to older adults and intensifying need for old-age support in the pyramid on the right. Next. Now, here's a striking feature of global aging. So the blue pyramid on the right is the same one you just saw for 2050. The green one on the left is a pyramid for the global population in 2024 without Africa's population. So if you take Africa out of the 2024 pyramid, the global population today already looks like the 2050 projection on the right and up, perhaps even a little older. So without Africa's youthful population, the aging future is already here. And Africa's population is slowing global aging a lot today, but this will not last. So many countries are and will be wrestling with the economic and social implications of rapid global aging. Next. So here is one last trend to keep in mind. This scatter plot shows the completed fertility rate, which is the average number of children women in their 40s have had along the x-axis, and the average ideal number of children along the y-axis. Each dot here is a country that has conducted demographic and health survey. So if the dot is above the diagonal line, women have fewer children than they ideally wanted. If it's below, they've had more children than they wanted. So what this shows is that across a number of countries, regardless of the fertility level of that country, women are not having quite the number of children that they desire, whether that's more or fewer. So across the board, there is much, much more to do to support women, couples, and families to achieve their fertility ideals. So to wrap up, fertility is falling, populations are aging, but the need for sexual and reproductive health and rights hasn't gone away. As Jennifer mentioned, today's conversation will unpack what these various demographic changes mean for sexual and reproductive health rights, how we respond, where we invest, and most importantly, how we keep rights at the very center. So thank you, and let's get started.
Fantastic, Toshiko. Thank you so much. The way to my heart is always through a population pyramid, especially one that you make. So I love that. Let's indeed get started. I'm excited to introduce our panel today. Today's discussion will be co-moderated by both me and my wonderful colleague, Dr. Apoorva Jadhav, soon to be a senior fellow at PRB. Apoorva is a demographer and global health expert with deep experience at the intersection of data, policy, and program design. She's worked with organizations around the world to advance reproductive health, gender equity, and evidence-based decision-making, and we're thrilled to have her guide today's discussion. Fadekemi Akinfaderin leads global advocacy for change at Feminista, where she works to advance sexual and reproductive health and rights worldwide. She brings deep expertise in feminist, rights-based approaches and a sharp lens on how global discourse affects policy and access on the ground. Traci Baird is the CEO of EngenderHealth, an organization working to advance sexual and reproductive health and rights and gender equality. She brings decades of leadership in program implementation and global health strategy with a focus on centering communities and health system transformation. Joining us from the United Nations Population Fund, Alessio Cangiano brings a global perspective on population dynamics and reproductive rights. He works at the intersection of demographic trends and UNFPA's mission to ensure every pregnancy is wanted, every childbirth safe, and every young person's potential is fulfilled. Jessica Gross is a journalist and opinion writer for the New York Times, where she covers parenting, religion, education, and the pressures facing women and families today. Her writing bridges data and personal experience, helping audiences make sense of complex issues like fertility, care, and gender roles. Dr. Johannes Wado is a research scientist at the African Population and Health Research Center in Nairobi. His work examines fertility, family planning, abortion, and related sexual and reproductive health issues across sub-Saharan Africa, offering essential insights into the social determinants of reproductive health and emerging demographic patterns in the region. Sanghamitra Singh is the Chief of Programs at the Population Foundation of India, where she leads efforts to strengthen family planning, adolescent health, and gender equity. She offers a unique perspective on India's evolving demographic context and the policy pathways forward. Thank you all so much for joining us, truly our all-star. So we're organizing today's discussion in two sections. I'll kick off with a discussion to take stock of where we are now and the degree to which this growing anxiety about low fertility is affecting sexual and reproductive health and rights. So for Sanghamitra, Johannes, and Kemi, are you observing any emerging signs of anxiety about low fertility in your context? And if you are, how is this playing out? And I'm also curious if you're observing or even anticipating this to have any impacts on SRHR. Let's go with Sanghamitra first, please.
Thank you, Jennifer. I think in the Indian context, the panic around low fertility is a relatively recent phenomenon, because up until very recently, the entire discourse has been around India being overtly populated, being the most populous country in the world. So much of the discourse has been around population explosion, so to speak. However, in the last couple of years, we've seen isolated experiments in certain states which have come forward and talked about how their specific TFR is declining. It started with the state of Sikkim in the northeastern part of India a couple of years ago, which has a population of about 700,000, a TFR of 1.1, where Sikkim introduced or proposed certain policies encouraging women to have more children. They were basically on the lines of offering longer maternity leaves, financial incentives for IVF, etc. And it was really the first time that a discussion like this had risen in the Indian context. And this year, it has also been observed in other states in the country, southern states of Andhra Pradesh and Tamil Nadu in particular, which have also scrapped two-child norms that they traditionally had for over 3 decades and are now encouraging women to have more children. Part of it is also due to the states. Part of it is also because in the Indian context, states also get a certain amount of revenue from the central government based on their population size, socioeconomic indicators, which a lot of these states which have now lower TFRs are worried they're going to lose out on. And I think what is really important right now is for the policy imperative to not really focus on correcting the fertility, but ensuring that every child is wanted and the lived realities of people are taken into account when any policy decisions are taken.
Oh, fascinating. Johannes, how about you? Thank you.
Thank you. Thank you very much, Jenny, for inviting me. As you have seen from the presentation by Toshiko, you've seen where most of the countries, the majority, are in terms of the fertility levels. So looking at that graph, the dynamics, we can say that low fertility as of today is not a major concern. TFR is above 4 on average, which means it's high fertility. But there are a small number of countries, particularly small island countries like you mentioned, Mauritius, Reunion, and so on, where TFR has gone below 2.1. So other than the very minority, in majority of countries, the focus is still about enabling women and couples to access comprehensive reproductive health services so that reproductive rights are ensured. And it's about ensuring that we attain demographic dividend in the nearest future possible. This is usually the policy priorities of countries by trying to ensure access to education, access to comprehensive SRHR services, improving employment opportunities, and so on and so on. So in a nutshell, it's not a major concern. However, doesn't mean there are no positions. There could be smaller, even in countries where fertility is not that low. Given the pace of the decline, there are concerns in some groups, particularly religious and other groups, that expanding access to some services and diversity and equity issues are not taken well for granted.
Thank you. Yeah, it's interesting when you're speaking, I was thinking about how we know in the data world, there are data and then there's perception. And sometimes that perception really has this power. Kemi.
No, exactly, Jennifer. And I'm really great that Toshiko was able to lay out the global context. And I think it's really important to also just kind of bring in, even within that global context and the regional diversity, I think there is importance for us to also recognize, especially in a region like Latin America, that even though we are seeing lower fertility rates, we're seeing an expansion and a growth in the teen pregnancy rates in such a region. And that itself presents a demographic, like parody in a way, if you can think of paradox, as you can see. But what for me, I think is a challenge, and we need to kind of keep in our mind is that we are seeing movements and actors kind of framing, and I'm going to focus my inputs in Latin America and Africa in particular, but really framing that, part of the reasons why we're seeing decline in fertilities in a region like Latin America and the Caribbean is the growth of feminism and the expansion of access to safe abortion and the liberalization of abortion. And this is being touted within the African context as something that we should try as much as possible to avoid, right? And by various actors and various players and really positioning, as we said, the population crisis as a national survival issue, as a threat, a cultural threat, and also the perception that it's a failure on women to fulfill their natural roles as mothers. And the reason for us to see the pushback and the rollback on sexual and reproductive rights and gender equality. So we really need to look at, how do we, and I know that we're going to come to it a bit later, but how are we actually challenging those notions? Because we are starting to see how that is seeping into the policy space beyond just the conversations within the general public and also within on a day-to-day basis with people. But we shouldn't also take away the fact that the conversations around declining fertility rates is also tied to other agendas, like immigration agenda, and also to the issues of also people of different diversity, to the LGBTQ agenda, and the rights and survival. And so I think we need to really make sure that we're actually taking a multifaceted approach, but understanding the greater context for which these issues sit overall. So I'll stop there.
Yeah, excellent points, all three of you. Can this be a whole day webinar? That's what I would prefer. But for now, we will keep scooting forward because I really want to hear from you, Traci, about how, as the head of a global SRH service delivery organization, what kind of messages or anxiety about low fertility you're hearing in the context of your programs?
Yes, and at this point, we're hearing different things in different places, as has been already hinted at here. Lots of different things going on depending on geography. And what we're hearing ranges from questions and to commitments to concerns. So a few examples from some of my colleagues, some of whom are on this webinar. Our team in India, for example, has noted that political leaders there are seeming concerned about low fertility, particularly in some of the southern states and smaller states. Some government officials don't want to talk about family planning, contraception anymore, or invest in contraceptive access, out of concern that low fertility may distort their social structure, lead to increased migration across states, and that state-based population figures, which drive budget allocations and parliamentary seats, as Sangamitra told us just a few minutes ago, will have an impact. So with fewer people they'll have less relative influence with the national government and fewer resources. So some hesitation then about continuing their commitment to sexual and reproductive health services. In Cote d'Ivoire, though, my colleague tells me that the main concern by policymakers is that if fertility rates drop, it'll be harder to gain investment in sexual and reproductive health and rights and contraceptive programs, and harder to mobilize domestic resources because fertility rates being lower make controlling and giving people options to control their own fertility less of a priority. And the concern, that we see and my team there are speaking about with colleagues is that if reduced resources are coming in for sexual and reproductive health and rights programs, then we're going to see exacerbated inequity, and the communities that are most marginalized will become even more so. In Nigeria, though, I know that UNFPA hosted a meeting on their State of the World's Population Report just last week. And I saw in the meeting note a powerful statement about the presentation. It said, the presentation revealed that the real fertility crisis lies not in demographic change, but in the erosion of reproductive agency. And I love that because that really is underscoring the focus among diverse policymakers in Nigeria to support efforts to meet unmet need for contraception, to achieve demographic dividends, not only for economic prospects of the nation, but also to reduce maternal mortality and uphold people's rights to contraception. So different things in different places, as is coming through with other speakers' comments. But this is part of the conversation that we are having in the countries where we're working.
I think it's almost like you've laid out for us a whole research agenda just in 2 minutes there. That was so rich. I want to pivot a little bit and bring Jess in here because I think, as I mentioned, the perception is important. I think rhetoric is as well. And you have this really amazing view on how the contours of this have gone on. So from your reporting, which is largely US focused, and that's great, and the reader engagement, how are people interpreting this narrative around low fertility?
I think it really depends on the person and often depends on their political persuasion. I think on the individual level, people feel it is quite distant from their day-to-day lives. Their decisions around when to have children, with whom to have children, are based very much on their personal circumstances, most often their financial circumstances. So I would say the number one and two things are meeting the right person to have a child with, because it is unusual to want to be a single parent. Lots of people are single parents and they move forward, but usually that is not an active decision. And number two, finances. So when the bigger picture fertility conversations are happening among policymakers and people who have strong opinions on it, people in their day-to-day lives feel like those discussions are quite distant from the way that they are living and often don't take into account their own desires. So I think that is one part of it. And then I think the other part of it is the conversations that are being had among both policymakers and then partisans who feel very strongly in multiple different ways about fertility. In the United States, obviously, there is a push among conservative lawmakers who often are anti-abortion, and some are anti-contraception, though not all, who also are very upset about fertility rates dropping in the United States, and they have very particular ideas about how to address that. But I think that there's also people who are not conservative who are concerned about low fertility rates just because of the economic implications, as many have already discussed, the impacts on Social Security, the aging population of boomers and who's going to take care of them and with what money and with what programs. I think also, just to say, the United States context is unique in the developed world in that we do not have paid parental leave. That comes up endlessly every time I talk about this, every time I write about this, just that there's a lot of concern among people who are considering having children about not even just the sort of 18 years of, caregiving and the expenses of that, but just in the immediate near term of having a baby, how will I be able to financially manage that pregnancy and postpartum periods. So that's sort of the long and short of covering it from the American perspective.
Yeah, I mean, two really important themes out of that, this individual to the aggregate, and then just the variety of perspectives on what we might have to give some air quotes on pronatalism. I think more of that will continue to come out as we talk. I want to stay on the rhetoric piece for a minute and send it to you, Kemi. You've written, I saw on Mother's Day, a really powerful piece about the rhetoric of strengthening families. Can you tell us more about what you've observed and where? Because strengthening families sounds like a noble mission. So what is it that's behind this rhetoric that troubles you?
No, absolutely, Jen. And it's very interesting as we speak right now. There is a conference on strengthening families happening in Freetown in this particular moment in time. And quite honestly, yes, on the surface, is it a noble cause? Yes. Who doesn't want to belong to families and who doesn't want to have strong families? But I think what we've seen over time is that this conversation is actually laced with other intentions. And so we've heard through our work, as FOSS, but with partners, and seen and participated in conversations that are actually more focused about pushing women's rights and women's bodily autonomy to the background. So what we are hearing is that, for example, under the guise of strengthening families, access to comprehensive sexuality education is the problem, because then it's sexualizing kids, et cetera, et cetera. Or, for example, access to safe abortion is the problem. It's not allowing people to have children. It's leading to infertility, all of this. And then really framing it as a threat. And this is actually gaining a lot of momentum, especially in several contexts. And it's no mistake that this is actually happening a lot on the African continent, and using it to weaponize and integrating it with issues around sovereignty, and integrating it with issues around cultural and religious rhetoric as well. And I think this is something that we need to keep our eye on. But in addition to the conversation around strengthening families, I think there are two other sort of movements and actions that we need to kind of put our eyes on. I think one, the manosphere sort of movement, and I think many people will already know this, and it's this movement that talks about male dominance and blaming women for the crisis and the loneliness crisis that men are experiencing. And then on the other side, the issue of trad wives. And it's a movement that's emanating from the US. And I'm sure, Jessica, you know about this a bit, and how this is actually really pushing back and saying, the agency and the leadership and the space that women are taking is actually what is undermining families, because we need to stay in this box of the traditional role of caregivers. And so it's really pushing against, everything from economic empowerment to bodily autonomy. It's pushing back against even leadership of women in different spaces. And this is what we really need to think about, this ideology that women, can't have both, that we have to pick one or the other, Yeah.
Oh boy, let's just pour another cup of coffee and dig into that. So I wish I might have personal feelings as well, which we'll push aside because I want to talk more about this. You mentioned threat, which makes me want to go to Alessio and talk about, not because he's threatening, but because he is, I have a question for him about population control, which I think is kind of related to that. So given that there's this historical discomfort linking family planning with population control, is there a shift now in how stakeholders are engaging with population issues and who's leading these? How are they approaching them constructively or politically? And, if there's time to even how are global fertility trends shaping reproductive health priorities and funding? We gave you a lot of questions.
Thanks a lot. And really, thank you very much for this invitation. I'm thrilled to contribute to this discussion and share some reflections on behalf of UNFPA. it is indeed true that historically there were tragic instances in various countries around the world where family planning was linked to coercive population control policies in an effort to reduce fertility rates and population growth. And this is why, the 1994 International Conference on Population and Development and its program of action was a landmark in affirming that every individual should be able to make free and informed choices about the number, timing, and spacing of their children. UNFPA is a proud custodian of this agenda, and we continue to support its implementation. However, as we saw in Toshiko's presentation, we are now living in a world that is demographically very different from 1994, where 2/3 of the world population lives in a country with below replacement fertility. And this is not just high-income countries, but it's also middle-income countries. And as rapid fertility declines have occurred, governments in a number of countries have begun trying to implement measures to try to boost the fertility rate. This ranges from one-off baby bonuses, tax credits, trying to incentivize people to have more children, but also more restrictive measures, banning comprehensive sexuality education in schools, discouraging women from working in the paid labor force, restricting access to contraception, and restricting access to safe abortion. So these measures to fix the fertility rate have proven to be largely ineffective, first of all. And we're going to talk more about this later, what works and what doesn't. But they can also be deeply harmful from the perspective of human rights. Let me just allude, I think a lot of the issues have already been unpacked very well by Kemi and Traci, and thanks also for mentioning the UNFPA State of the World Population Report that looks at these issues. I want to mention a couple of more things in relation to how this is playing out in international fora. We are increasingly seeing red lines in multilateral processes for the advancement of the International Conference on Population and Development, which makes it increasingly difficult to achieve consensus outcomes in intergovernmental negotiations. So, for example, the last Commission on Population and Development was unable to achieve consensus on a draft resolution on the special theme of health for all at all ages because of deeply entrenched divisions on core issues such as gender, SRHR, the role of family, gender-based violence, and others. Also compounded by emerging and worrisome disagreements over references to the 2030 agenda, inclusion, and climate change, for example. The other thing I want to reflect a little bit is about the funding that you mentioned. And I think for me, what is really important here is that, if we just focus on low fertility, we are also losing sight of the millions of people around the world who still have more children than they actually desire. And this has also been shown in Toshiko's presentation, and who are unable to realize these aspirations due to limited access to family planning and sexual and reproductive health. This is very much related to the funding issue that was alluded in your question. Many low-income countries are highly reliant on overseas development assistance for financing of their health systems, and the withdrawal of international donor support and the crisis of multilateral cooperation that is unfolding are likely to constrain the reproductive choices of many more individuals around the world as a result. So let me stop here for now.
Yes. I think it's great to point out this, like the slide that Toshiko had where they're not having the number of children they desire on both sides of it. And I'm going to borrow a couple of minutes from Q&A so that I can ask about the other side of it, which is the infertility piece, to Johannes and Sanghamitra. Because this new UNFPA report, which is excellent, finds that 12% of people cite infertility or trouble conceiving as a reason for having fewer children than they wanted. That's 19% in Thailand and 13 to 15% in South Africa, Nigeria, and India. So theme of this panel so far is at least two things can be true at once, right? So how might our thinking change if we stop viewing infertility as just a high-income country issue? And are governments and donors ready to support this emerging frontier in reproductive health amid these growing population anxieties? Johannes, if you would answer first, please.
Yes, thank you for the question. This is really very relevant. As you mentioned, based on the UNFPA report recently, as well as the 2023 World Health Organization report, infertility is no more, or is not the issue of developed countries only. It is really very common in our setting as well. It has been there in the past, it is here, but it is the only problem is that it has been neglected. And as you know, given the ICPD framework of sexual reproductive health, infertility is an important but it has not been a priority component of SRHR issues, particularly in low and middle income settings and in our settings, largely because the focus has been both for national governments as well as donors. It has been about preventing unintended pregnancies, and resources are largely allocated to ensuring that people have access to sexual and reproductive health services. The other bit is also there has been a lack of data, but the challenge is there. In the old days, as you know, infertility in Africa was largely associated with STIs, HIV, and related. In addition, there has been causes like infection from unsafe abortion and other obstetric infections. But as you see, there are groups of population where lifestyles are changing. Age at first birth is delaying. So the focus, the change in terms of prevalence is also there. It means infertility affects huge number of people, and it needs to be an important component of the conversation. The WHO report, as well as the fact that WHO declared infertility as an important public health issue in 2023, is bringing up the issue of infertility to the focus, as well as there are small advocacy groups in countries like Kenya. We have few NGOs advocating for infertility, although the service is strictly, seriously unavailable or extremely unaffordable in our setting. The infertility services are not affordable. Public sector is not providing. So this is a time when partners, funders, as well as governments really should move the conversation forward. It's a very timely issue to look at it.
Very interesting. Thank you, Sangamitra.
Yeah, I echo a lot of what Johannes said. I think in the case of India, infertility has largely been looked at, viewed as an urban issue. And what the report really tells us is that it is a reality. It's already here. It is a problem in the country, and there is very limited data around it. I think another very, very ignored factor is male infertility, because almost half of the cases of infertility are in men, but they are not tested. The prevalence is not as surprising as the barriers which continue to exist in India, which is the lack of conversation around male infertility, or the myths and misconceptions that continue to persist around it. And of course, there are high out-of-pocket costs. Like Johannes also mentioned, these services are not covered by insurance. They are only available in the private sector. So going forward, I think it's very important to integrate infertility treatment as part of the public health system as well, and to have conversations around male infertility. And I think it's equally important now to include this aspect under the broader umbrella of comprehensive sexuality education, which has traditionally focused on preventing unwanted pregnancies. I think it's important for people to understand when, how to navigate challenges and seek help. And that's really only possible through education and awareness.
Thank you. Fascinating first panel. And I also wanted to mention there are so many questions coming up, so many people flagging for us, as we well know, that you would love for us to talk about environmental issues. We'll be doing a blog or two or more, some sort of written follow-up to this event so that we can keep the conversation going. So you can look out for that. And the recording and slides will be made available as well. Let me hand this. One thing actually I did want to mention, because I think it's good news. Funding came up, and And I'm excited to share that we're finalizing a pilot effort under the Packard Foundation, through which PRB and EngenderHealth are teaming up to systematically assess and how low fertility anxiety is affecting commitment to and implementation of SRHR policies and programs in a variety of contexts. So we'll do this through a series of stakeholder consultations in a 4-country pilot, and with some global family planning stakeholders who may be coming to some of you. So if you're interested in sharing your experiences and insights, please let us know. I know there have been a few times that our team has dropped in the chat places for you to comment. Again, a conversation we want to keep having. And so thank you, Packard, and thank you, Traci, Baird, and EngenderHealth. I want to pivot from taking stock to looking to the future. For that, I will turn over to our co-moderator, Apoorva.
Thank you, Jen. And you mentioned before moving from panic to purpose, and I think that's what this next panel is really going to focus on. And the thing is, we're a set of demographers, sexual reproductive health researchers, and academics and experts. And a lot of times I feel as though we feel that we're being reactive rather than proactive for a number of things. We just ended with Johannes and Sanghamitra talking about infertility. The State of the World's Population Report talks about low fertility, of course, but also population aging. There is no reason for us all to feel, well, we don't feel, but for the rest of our communities and governments to feel like this is something that we couldn't have seen coming. We could see this coming. We can be prepared. We can be proactive rather than reactive. And let's not kid ourselves. Demography and family planning is political. And so how do we get ahead of that? How do we get ahead of some of the messaging that we're seeing? I love that we talked about trad wives. I don't know what the correlate would be for us, but maybe we'll get to that someday. But I want to move towards looking to the future. So I think this focus of this panel will really be on what approaches and narratives are helping to frame this discourse productively, and what resources and tools do we need? There's researchers, there's funders that have joined this panel. Let's talk to them. We have the spotlight. And so how do we frame some of our asks in a more direct way? And also, what is the policy research agenda? Let's roll up our sleeves and work together. So with that, I'd love to start my questions, but I do want to note that Devin has dropped a poll in the chat. So if you all could take a look at that, that would be great. And I'll start with a question to Traci, Johannes, and Alessio, maybe with that order, if you don't mind. So the first question is this: what does a rights-based, holistic reproductive health response look like in this low fertility context? And a kind of follow-up to that is, what's needed to protect autonomy amidst these demographic anxieties? So Traci, over to you first, and then we'll keep going with Johannes and Alessio.
Sure. So I actually think a rights-based, holistic reproductive health response looks like it always has when we've gotten it right. The context may change, but when we center rights and hold on tight in the headwinds. There's a fantastic UNFPA framework that I think we'll link to in the chat that will describe and define a holistic, rights-based reproductive health program and response. And this really needs to center individuals and recognize their human right to decide if, when, with whom to have children. And also to center the fact that people have the right to seek care for all of their sexual and reproductive health needs, not only those related to pregnancy and childbearing. And at EngenderHealth, we support a human rights-based approach by ensuring that individuals have support from their communities, have access to high-quality services, and have a policy and societal environment that supports their choices. I think what we're seeing and hearing through this conversation is that fertility anxiety is really a function of what's happening at a societal level, right? These are population numbers. This is happening around us. And human rights-based sexual and reproductive health and rights focus starts with the individual. So providing comprehensive sexual and reproductive health and rights needs to continue as people continue to age into needing the support, needing comprehensive sexuality education, needing contraception, needing safe abortion, needing care during pregnancy and delivery, needing support to address infertility, needing support in later in life, past reproductive age, but when they still have sexual health needs and desires. And as more people enter the reproductive years, we have to ensure that they have that full range of options and services. And I know as part of what we do in the reproductive health community is we're trying to expand those options, right? We don't want our list of contraceptives available today to be the same list tomorrow. We need that to expand. A colleague of mine in India, Dr. Ajay Kara, who I believe is on this webinar, offered me an analogy. He said, when a community reaches a certain level of immunization coverage, we don't stop offering vaccines. We know that each cohort of infants and children need access to those vaccines. And similarly, irrespective of a population level indicator like the total fertility rate, each cohort of people that comes of age when they need comprehensive sexuality education or contraception or abortion care or pregnancy-related care, those people deserve to come into communities that have those services and offer that care as it's their individual human right. I just want to note that this connects to a comment posted in the Q&A by Carrie McQuarrie, which is the idea that after so many years, decades of focusing on bringing down the total fertility rate, now that it's dropping, perhaps people are thinking we're done, right? But really, if we shift the focus to individual rights and human rights, which according to the ICPD program of action, as we heard a few minutes ago, that was the agreement years ago. We want this to remain an ongoing priority. And my last comment is that, a key issue as underscored by my colleague Mohamed Lee from Cote d'Ivoire is that if we invest less and if we don't focus on the rights of each individual coming of age and into their time when they need the information, care, services, and support, the chances are enormous that we are going to have inequity, that people in communities with less power and who are more marginalized will have less, and we will have an even greater disparity. So we need to make sure that everyone, everywhere, is guaranteed access to sexual and reproductive health and rights information, services, and care, because until everyone can benefit from comprehensive sexual reproductive health and rights, we haven't achieved that rights-based human-centered reproductive health response that we're talking about.
Fabulous. Thank you, Traci. I loved the life course perspective framing on this and the fact that it's not just women, but it is also men and it's others that are working together to kind of reach their potential. Johannes, how about you?
Thank you. I fully agree with the points made by Traci. This is about ensuring that individuals attain their reproductive goals, whether these are people who want to delay or prevent unintended pregnancy, or like we discussed earlier about issues of infertility, people who desire to have a child. So policies, governments, decision makers should strive to ensure the reproductive goals, that the number of children, the timing, whatever, as earlier defined by Alessio and others. So this is about ensuring individual decisions matter without coercion. Like in the history of family planning and reproductive health, I think Alessio highlighted that there have been experiences around coercing populations, communities, and individuals to attain demographic goals. So I think per the ICPD framework, we have shifted away from that. For low fertility countries, we know the policies that they have been trying to implement. This could be providing incentives in some ways, even in our setting where the fertility is still high, there have been experiences where incentives, coercion have been taking place. So it's about avoiding all those and ensuring that individuals attain their reproductive goals. I think without repeating most of what has been said, in short, yeah, I stop there. Thanks.
Fabulous. Confirmation is also a good response, so that's great. Thank you. Alessio, over to you.
Yeah, thank you. Thank you very much. I think these were already great responses. Obviously, again, the individuals at the center. What we are learning, and the more we do research and the more we collect data, the more we keep learning, there are barriers that people face in realizing their reproductive intentions. The State of the World Population Report did a survey of 13 countries from all world regions, and again, finding that there's a large proportion of people who cannot realize their fertility intentions in one way or another, either because it's too many or too few compared to what they want. And they cite a number of barriers. More than half of about 10,000 respondents that we have in our survey cite economic issues, financial security, employment, housing, as a factor for having fewer children than they wanted. So obviously, a holistic response needs to address these barriers, needs to look at good jobs, decent wages, good working conditions, as well as investment in affordable housing. 1 in 3 people cite health barriers. So again, a holistic response includes universal health coverage, also ensuring that ethical access to medically assisted reproductive technology is not just available for the wealthy. Gender inequality is also often cited as a barrier, requiring investments in measures such as social norms campaigns to encourage men to share the load of housework, childcare, etc. Affordable childcare, general flexible parental leave, flexible work arrangement policies, this can all contribute. There is no silver bullet. There is no one-fits-all solution, but there's a range of solutions that can be adapted to the context and that can respond to individual needs. That doesn't mean, of course, that this is just one part of the story in any way. So it doesn't mean that the fact that governments should not interfere on coercing people to have more or fewer children, it doesn't mean that they should not do other things to address demographic change. Doesn't mean that they should be just passive bystanders watching demographic changes unfold. There's many things that they can do to better understand, anticipate, plan for, and adapt for demographic change. There's a lot that can be done to adjust institutions to a different type of society. We need to understand that demographic change is inevitable, and it's very much part of development. And therefore, we just need to foresee what's happening. We have the tools to foresee what's going to happen, and we have opportunities to plan in advance. And this is what a holistic government policy should also do. Definitely, I think. Sorry, just to say, we're definitely also just scratching the surface in terms of understanding how people's preferences for having children are changing in this world. So I want to highlight also the importance of more research to look at how preferences are changing, what is on people's mind, on young people's minds, how insecurity around climate change, for example, is affecting these preferences, how use of technology is affecting these preferences. I think all of these are emerging issues that we're starting to see, and we definitely need to better understand.
I think your response actually teed me up really nicely for the next question to Kemi and Jennifer, if you don't mind. I think that your point is really well taken about the different barriers that we've been discussing. And a lot of times there's this quip that's demographic anxieties can't be solved by demographic solutions. But a lot of times governments are kind of using that as a crutch, and we're seeing that in the global north, we're seeing that in the US. And so I think the question is then to Kemi and to Jennifer, what is the role of governments with respect to low fertility while keeping some of that framing in mind that the solutions are always, well, it's generally a demographic solution and it's generally falling on the woman. So what do you have to say to that?
No, thank you, Apuva. I was literally like jumping off my seat when Alessio was speaking, and it's one of the reasons why I really love this new State of the World's Population Report, because it really gives us the details, right? And I think it's important to say that everything that Alessio had mentioned is really also connected to like a reproductive justice approach, and this has been something that Black women in the United States have been talking about for years. That it's not just about the right to, well, it is included in the right to choose or not to choose, but also the right to be able to raise children in a sustainable community. And I think that framework is really key to be able to bring in the elements around housing, around childcare, around employment, around parental leave, and on all of these things. And these frameworks have existed even pre-ICPD, so it's not something that it's new, but it's something that I think we really need to kind of give a lot more energy to in the conversation, especially in the policy space. So I think in this moment in time, for government, sometimes the easy fix is to have the demographic solution versus talking and reflecting about the fact that our lives are not single issue lives. So it's not just about providing family planning. It's really looking at how all these issues intersect to be able to influence the decision, but to also be able to influence choice. And so we can't necessarily take a demographic solution to this, but we need to look at one that centers choice. And so looking at how is it that governments are able to really sort of create opportunities for cross-sector analysis, connection, and collaboration that is really centering the needs of women and girls and all their diversity as the heart of these social policies and programs. So that these programs, be it from the health, perspective in terms of delivering universal access to sexual and reproductive health, or be it from the economic piece, is actually meeting the lived realities, right, of people on a day-to-day basis. I mean, Jen, mentioned a blog that I had posted on LinkedIn, and I was doing a bit of reflection on this when I heard about the tax credits and the baby bonuses and things and I was like, these are really like band-aids on systemic issues. And it's not necessarily reflecting what people's day-to-day lived realities and desires are. We need to really think a lot more systematic and really try to get at these root causes of what is driving people's desires and people's needs to either want children or not to want children. So I'll pause there, and I'm sure Jen has some pieces to also add as well. So over to you, Jen.
Oh, well, I mean, I cannot say it better, and I think my head will fall off my neck from nodding if I'm not trying to control myself, because I think you hit the nail on the head there. And I guess let me maybe offer an example that's outside of this, just to illustrate what I think Kemi and I both feel about when problems are painted as population problems, then you look for a population solution. But what if they're not population problems? And let's just look at national security, for example, and U.S. military recruitment. So if the U.S. military is having a difficult time recruiting already, and then the age structure shifts so that their pool shrinks, is that a demographic problem, or are there larger problems that become highlighted and so much more visible once the age structure has shifted? Is population aging itself a problem, or was it the institution of a pay-as-you-go social security system that no longer fits this demographic reality that is the problem? The thing is that I don't think we're anywhere close to having most policymakers around the world do that mindset shift from this is a population problem, and therefore we shall offer this bonus or restrict, more births, fewer births, whatever the case may be, to it being about something else. Some of these structural issues, for example, some of them are other policy issues. And that's really something that I hope we start to see change, because I do think that there are consequences of continuing to see things as population problems. And one of those is also, a piece I had written in May, that governments are just really frustrated as, well, why isn't this working? Because I was told this was a population problem, so here's my population solution. And I think it does highlight that there's a real limit to what governments can do to change the dial on fertility.
I think we need more demographers in government. I think that's the key. Kemi and Jen, I think what the technical term for this was, it was a mic drop. So kudos. You're getting a lot of kudos in the chat. I think that as you were as you were talking, Kemi, I was thinking about how the demographic dividend and that discourse is so similar, because a lot of times we were talking about, well, this is what governments should do, this is what governments should invest in, and we were talking to very our echo chambers rather than talking to government as not a monolith. And so who are the right ministries to be directing some of this to? And I think of low fertility and you think of the solutions, and it's not just necessarily the ministry for women and children. It's a lot more actors that need to be brought into the conversation that may not necessarily be paying attention. You mentioned national security, Jen. I think that's kind of part of that, bringing others into that discussion. And maybe as we're moving towards who all to be bringing in and who all do we talk to, it's a great transition over to you, Jessica, to think about narratives and reframing and storytelling. So the question to you then is, what do you see the role of journalists and storytellers in reframing these issues for the public, outside of the jargon, outside of these echo chambers that we're even in right now of 400 people?
Well, I think number one is getting at the individual human experiences beneath the statistics, because statistics are statistics. They are cold. People don't really relate to them. They're meaningless in most people's sort of day-to-day lives. Choosing to have, your third child, something, knowing what the fertility rate is in the United States is an utterly meaningless piece of data to most people, I think. So I think sort of humanizing all of this information and talking to people into this sort of nitty-gritty about why they are making the decisions, if they are in fact decisions around the fertility that they are making. So I think that's sort of one really important thing. I think another thing is deconstructing a lot of froth. So I put in the chat a piece that I did about tradwives, which Kemi brought up. There is almost no data to suggest that young women in the United States are desperate to have 8 children and live on a farm. That is not what any statistics show us. Do they like looking at these videos? 100%. That is all that shows us. So when there are these trends that are very sexy and they're fun to talk about and they're fun to dissect and criticize, understanding beneath that, if you're talking about young women in the United States, I talk to a lot of Gen Z. I look at a lot of Gen Z polling. They want to be financially solvent. We haven't really talked about climate, which is, brought up. Many are very concerned about climate and the implications of bringing children into a warming world. So, they're not thinking about whatever an internet label for themselves is going to be. They're thinking about, what is my future? How can I make ends meet? Considering the life is as it is in this moment. They're not thinking even about Social Security 60 years from now. And I would be sad if any 20-year-old were thinking about that. They need to have some fun in their lives. But, I think it's understanding that people's lived realities are so divorced from a lot of what gets talked about, I think, when we're talking about population issues writ large. And I think one thing we haven't talked a lot about, but what I hear all the time from readers in my reporting is caregiving for older family members. And that is something people think about all the time and is affecting their fertility choices now. Because if you're saying, okay, well, I have one kid, my parents are in their 70s. I know that they have X, Y, and Z health problems, and there's not much of a safety net to support them. I know I'm going to be the one. Usually, I think last time I looked at the statistic, the average sandwich generation caregiver was a woman in her 40s. So, I think this is a complicated puzzle. And it isn't just about, meeting and mating and what our governments can do. There's all sorts of choices that are coalescing into fertility choices, if that makes sense.
Well, thank you for storytellers like you who put the human face beyond the numbers and beyond the statistics to readers worldwide. And I hope there's many more such journalists that are going to take this mantle on. I want to keep an eye on the time. I know we're over time, y'all. We have 2 more questions, if you don't mind. And of course, we had the Q&A, but I'm glad that we'll be able to do a blog post. So if you don't mind, I'd love to make sure we're getting through the questions. And please keep those questions coming. We love that this is an engaged bunch. We knew it would be an engaged bunch, but it's also a controversial bunch, which I'm liking as well. So the next question then is to Johannes and then back to Jen. What are the biggest research gaps? What data do we need to guide more effective and equitable responses? Johannes, would you mind tackling that first?
Thank you. Yes. As someone who represents the Sub-Saharan Africa region, where low fertility is not a major concern, I want to reiterate the point earlier raised by Alessio around the challenges that are happening due to reversals in funding or funding cuts to SRHR. So questions like what will happen to fertility trends? Do we see reversals? Do we see stalling? And it's going on. How do governments respond to these challenges? And what are our options? Sometimes we see conversations from opposition groups that access to safe abortion care, access to comprehensive SRHR is being opposed. So those are the challenges we have. And in line with low fertility, I think like the speaker said, understanding the dynamics around reproductive decision-making is important. What factors really contribute? We have seen that from the UNFPA report that there are a good number of people who want to have more, but are not able to ensure. We also have a significant population in our region where a desired number of children is less than the number they have. So understanding those dynamics is important, and importantly also looking at the effect of emerging issues. In our region, we have conflicts, we have infectious diseases, we have seen COVID as well as climate change. How do these issues affect decisions, preferences? We talked about infertility. There is little evidence if you look at country level statistics in our setting as well as in other parts of the world. Infertility is really ignored, and we need to understand men's perspective, the role of men, the dynamics around infertility that affects men. And lastly, we have, as people who work in the field of sexual and reproductive health and demographers, we have measurement challenges. Some of the concepts we have been discussing, like reproductive autonomy, agency, empowerment, are really not understood well, are not measured well. We talk about fertility preferences, fertility intentions, and there is a lack of longitudinal data and improved measurement. And now that we live in a time where there is no more DHS, and other big data sources. And it's really critical to discuss how the data comes into really show the improved measurement around these important concepts around reproductive autonomy, reproductive rights, empowerment, agency, and so on. Let me stop there.
I hope there's funders and researchers listening to this. We need longitudinal data, and we have so many research topics that we are ready to see some results on, maybe on the sandwich generation as well, and so much more. Jen, over to you.
Yeah, I'll make mine under 60 seconds because that was fantastic. I think, yes, one, how these preferences are changing, how people are able to realize them, and how really holistic and nuanced measurement can better inform policy is one area. And I think another is, and this is, me with my political science hat on, is how policymaking is made across silos and how those silos actually impact the ability to have policies that improve well-being. Many of you have heard me say this before in a keynote, but I always observe that governments around the world will say that women need to birth more, work more, and care more. And one ministry will be focused on how to get women to have more babies, while another is trying to get them to increase their labor force participation rate, all in the context of increasing pressures on caregiving, as has been mentioned, both, sandwich. Those policies often work at cross purposes, and I think, again, lead to governments being even more frustrated, and again, puts the onus on oftentimes women as the solution to population problems that may actually not even just be population problems. So I'd love to see really comprehensive views like that. And I also think that leaves space also for convening ministers across these silos to have them understand how, you know, when you do this one thing, this butterfly flaps its wings and this, you know, you feel the storm over on the other side.
Well said. I think the final question is then to wrap things up. What, if that's okay, yes, we have 6 minutes. To Sangamitra and to Kemi, what kinds of policy reforms or messaging strategies are proving effective or even potentially harmful in your regions? We'll start with you, Sangamitra.
So I think India, it's given that India has had it probably has the oldest family planning program in the world, and it has achieved replacement level fertility eventually through completely voluntary measures, greater investments in healthcare, education. It has really set a benchmark for itself as a nation. And now, when we see calls for coercive measures in isolated population policy experiments across the country, I think what is really needed is that different geographies, different states, which are in different stages of demographic transition, they actually learn from the country's own experience, in addition to experiences from rest of the world. I'd also like to highlight that when policies are being made around population issues, it's important to forget the fact that there is an ideal population size or there is an ideal fertility rate. I think for too long, policymakers have functioned with this mindset when population numbers were high, at least in India, when fertility rates at the national average was really high. The only target was to achieve replacement level fertility. And what's really happening today is that when we have achieved replacement level fertility, policymakers don't really know what to do next, because that was really the end game. And now there are all these complexities which they are dealing with, which they are probably not handling with the kind of nuances that are really needed, which actually really involves an understanding of the complex interplay between changing population dynamics, gender equality, women's empowerment. And that kind of sums up the various recommendations that have come from other panelists: the need for greater data, for research, for demographers to be on the decision-making table. And only then will we be able to come up with reforms which really factor in the needs of the population and the lived realities of our population.
Well said, Sangamitra. Over to you, Kemi.
No, thank you. I was going to speak more to policymaking, but I think I'm going to speak to the issues of men involvement, because there's been several comments in the chat around the issues of men. And I did mention earlier the whole conversation around the manosphere and how this itself is also driving some of these, I would say, harmful narratives and how it's seeping into the policy area. I think there is a real need to kind of not frame this as a dichotomy, but this as like, it's not the men versus women issue, but it's looking at shared challenges and shared responsibility and joint solutions. And I think we need to be able to move the conversation from a space of dominance to one that looks at communication, that looks at co-parenting, co-decision making. And we need to move men away from the conversation of being victims of especially the conversations around feminism, the conversation about women's autonomy and decision making, and moving them more to a place of like, how is it that I am a partner in this conversation? How is it that the issues of family is something that we're jointly making decisions on, and how we can be able to plan for the future? So I do think that, in addition to everything that has been said earlier, to look at how are we promoting the issue of parental leave and caregiving roles and centering the issue around the care economy within that? How are we investing in teaching and scaling up men's relational skills, right? and their ability to be able to work, especially amongst young men now, given what we're seeing around these recent conversations. I'm sure everybody has watched the movie that came out a few months ago, but also looking at the issues around economic insecurity, right? And how that's also driving misogyny, and how we're also looking at issues around decent job, housing, community building, etc., as a way to shift this narrative that places the burden of low fertility on women, and the need for us to be able to look at how partnerships can be able to move that forward. My last thing that I would say, Apruva, is just the fact that, like, we can't necessarily just turn back the hand of the clock and restore fertility and change the demographic pyramids, etc. But what we need to do is actually to restore systems of care, systems that value choice, systems that value and support and enable both women and men to be able to participate, to make decisions in family life without sacrificing autonomy and without sacrificing opportunity. So if we really see this issue of low fertility as something to be addressed, we need to remember that it's a mirror of the kind of society that we actually have, and a society that does not center people and the care of people on a day-to-day basis. And so that's what we need to invest in and make sure that we get it right.
That's an insightful ending to this amazing panel. Thank you so much to everybody for your time and for your thoughts. I think I will just hand it over to Jen because we are at time to wrap up.
Thank you so much. Unbelievable discussion, and a very rich discussion in the chat as well, with a lot of disagreements. And these disagreements are important. They do require more than the sound bites we're all able to give here to truly address them and give this nuance and contextualization that they deserve. So we did get to some of them in throughout the discussion, some of the questions you all had posed, but for ones we didn't, just wanted to let you know that we do have those saved, and we are going to make an attempt to address them in a blog of sorts. We do have other webinars that will follow after this one. You can register for, be notified about those at the link that was put in the chat. And be sure to follow PRB's LinkedIn. Please feel free to connect with me on LinkedIn as well, because I will post there. We don't have the dates for the other webinars yet, but we know what we want to talk about. And we hope basically we can keep this discussion going because it is just so incredibly important. So thank you again to our tremendous panel, and thanks to all of you. Over 300 people hung to the end, which is pretty amazing. And I think that is a true testament to how rich this discussion was. Thanks to all of you. Thank you to those of you who joined us live or through the recording. And yes, we will have the recording available. We will, again, if you follow us on social media, particularly, I think LinkedIn, we tend to be pretty active there. Find ways to post that. See if we can maybe put it on the webpage for this fertility series. And we look forward to just continuing to talk about this with all of you. Thank you again so much.
Thank you.
Thank you.
Thank you.